When an employee learns that they have cancer, they need to determine who really needs to know. Usually they begin by telling those people with whom they are most comfortable.
I think another thing that comes into this for many people is that when they get diagnosed with cancer, one of their greatest fears is they're losing control of their life. They're losing control of their ability to make decisions for themselves and influence the outcome of their life. And telling or not telling is a great big choice that they can make. It's one area where they can maintain control of their life.
I had friends and coworkers that were concerned about me and, didn't know what to say, didn't know whether to call. I went to my supervisor many times, and she actually called me at home one day and just asked me, what information would I like disclosed about my condition, if anything.
It's a very private thing. When you're sick, you need to deal with it the way that you want to deal with it and share what you want to share with people.
I would say, Mary, let me know at what point we can share some things. I have a lot of staff that's very, concerned about you. They're asking questions. You let me know if there's things that you're comfortable with me telling them because they do care about you.
People want to know, how is my friend doing? How is my coworker getting along these days? But if everybody in the company asks the person with cancer, they never get a break from thinking about cancer. I tell people, find a friend or a colleague and make them your point person for communication. Make them your communication director, your PR manager for this experience.
A manager or human resources individual should take the lead and must first determine what information, if any, the employee with cancer wants to share. Encourage the employee to tell everyone who needs to know, particularly those who may be affected by absences from work. Determining whom to tell will also depend on company size and culture. Ask if a designated person can share ongoing information with others, because it's better for everyone if information passes through one person, not several. Choosing one designated person can also help regulate the flow of information and keep it restricted to what the employee would like coworkers to know.
I was actually out for 7 months once I had my transplant done. I had 6 weeks of radiation after the transplant was completed. And I think during the entire time I was concerned, will they let me go? How secure is my job? What would happen if I, don't have medical insurance coverage? Because I was a single parent, I still had one child at home.
Many people's insurance, their health insurance, their very ability to receive treatment may be tied in with the employer also.
I approached my previous manager, who had been promoted, about my transplant, whether that we were going to get that approved, and how my employer was going to feel about something that was that high dollar. And she immediately told me, "You don't worry about that." She said, "I will see that this is taken care of."
Most patients do not understand their insurance coverage at all. And it's overwhelming, the amount of paperwork that's involved for the patient, what the coverage is, what benefits they do have, and when it's appropriate to even discuss it with them.
Lots of times people have much more information than they realize they have available to them. They usually have some sort of written information about their company's policies and benefits. And if they look in their files and their paperwork, they can probably find out what they signed up for.
I had him just bring everything to me, at which point I sorted through all his paperwork, set up spreadsheets, tracked what was payable by his benefits or his coverage as far as deductibles, and the limit of out-of-pocket, but we tracked it all for him because we felt like that's the last thing the family needed to be dealing with.
We had all that paperwork done ahead of time, so that was not something that I had to deal with while I was out from work.
For me, it's very important as a manager that we make sure that we give them all the information that they need to make some really sound decisions.
Well, when Mary came to us, we helped her make decisions on what she needed to do and showed her what was available to her.
We kind of looked at a roadmap where, at what point could she come back and how she could come back into the workforce, but also be comfortable with the job that she was doing and, leaving with the sense that she had done a good job at the end of the day.
And we assured her that we would keep her position and work with her any way that we could. And all of our staff pulled together, and we helped, when she did come back after the 4 months, we just created an environment that would help her in the healing process.
I felt pretty comfortable about leaving and feeling like I had a job to come back to.
I felt very strongly that Mary, though she had exhausted her benefits, that she was definitely a good employee, and I wanted to do anything that we could to keep her on board with us.
When people are in a crisis and you help them, you support them, you make it possible for them to get through this with as little stress as possible, feed their family, feed their children, they're going to remember you. And they're going to be one of the best employees you've ever had.
There are many ways that an employer can make the situation easier for an employee facing cancer. Having discussions to alleviate concerns about benefits. Sometimes there are concrete options to help maintain income, such as flexible work hours and/or working from home. Clear communication and expectations about using leave time can reduce the employee's anxiety. When possible, managers should provide realistic reassurance to the employee about keeping their job. Above all, keep the lines of communication open with the employee and their family to ease fears. Most employees with cancer want to continue working for many reasons. In addition to maintaining income and insurance benefits, they also want the feeling of normalcy that work brings to their life. When an employee feels as normal as possible, coping on a day-to-day basis with the stress of their illness is much easier. Managers and co-workers are an integral part of this process, and managers in particular can help balance between company procedures and employee needs. Managers also need to be aware of too little or too much information sharing, which can influence workplace morale. They also must supervise the impact of the employee's time off on the workload. Managers can also help the employee with cancer by offering flexible work schedules and rest periods whenever possible to help the employee who is fatigued from cancer treatment. In this chapter, cancer patients share what they learned about how to deal with work during their treatment and some of the obstacles that they encountered along the way.
One of the difficult things about being diagnosed with cancer and being an employee is that cancer may change what kind of employee you are or the work that you can do.
For me to claim or anyone to expect all patients to be able to work during cancer chemotherapy is a little naive. But in my view, the majority, more than half, in fact, do go back to work or work intermittently. Some of them don't even miss a day of work. This depends on the type of malignancy or type of cancer they have, the type of therapy required, the intensity of the therapy, and the side effects or our ability to control the side effects.
I really wanted to go back to work because as long as I was at home, I felt like I was sick, and that's all I could think about was being sick. But if I could just get to work, then I could focus on that job and not think about, myself and what I was going through.
So much changes when a person is diagnosed with cancer. And if they can keep just one thing normal, if they can just keep one thing the same, it can go a long way toward bringing comfort, stability, consistency to their life and to their emotions.
Working makes you feel normal. The hardest thing about having any type of illness like that has, can have devastating effects on your family is the ability not to be normal.
My plan was to have chemotherapy on a Thursday or a Friday and have the weekend to recuperate, maybe take Monday, but I was going to get back to work, and I just knew that was going to work. Well, the first treatment, I did do that and ended up going back to work on Monday, worked a couple days, and was sick as a dog for the rest of that week, and and I just was very, very sick. I just pushed myself too much. And from that point on, then my coworkers and my family and my physician all supported me with the notion that I needed to take a full week off after each treatment.